Well, hello, everybody, and welcome to another episode of Mind Your Mouth podcast. I am your host, Melissa Mugno, and I am so excited to be here with all of you and a really fabulous, fun guest that I am super excited to have this conversation with. As always, you guys know that on Mind Your Mouth podcast, we are always bringing people that maybe you've seen in other positions or on other podcasts, but hopefully you'll see another side of them in a different conversation today. And I am hoping that today will be no different. So I'd love to bring on and introduce everybody to an amazing speech therapist that I was able to hear over this summer, Ronit Agassi, and I was blown away by your presentation and couldn't write enough notes and take enough videos to take it all in because I had never really heard somebody present it in just the detail that you did. So if you wouldn't mind, introduce yourself to the podcast guests and to all the audience and tell us a little bit about who you are and what you do.
So I'm a speech therapist and I am certified by the MNRI Institute, the Muscatova method for neurosensory motor reflex integration. I also utilize other kind of oral motor and myofunctional protocols. I've taken the IAOM course for myofunctional work, SOS feeding, and I try my hardest to bridge these what seem like different avenues and different modalities of therapeutic intervention into a cohesive, holistic, integrated approach so that we can maximize outcomes and really maximize growth, resilience, and ability to function for specifically the pediatric population. And I have worked like throughout the lifespan, but primarily work with the pediatric population. And my goal is that when we are calm and regulated, and when we're breathing well and sleeping well, in addition to some of the other modalities that I use, and our nervous system is regulated, we are better able to then, we're open to learning, we're open to new experiences, and we're open to growth.
That is super detailed in the different avenues that you kind of work in. And I know for some people that are tuning in or listening, they're like, okay, so speech therapy, we have this idea of what a speech therapist is. And I think a lot of times people think it's just articulation, verbal cues. And I'm sure you could relate how many people be like, oh, my kid speaks just fine. And it's like, how do we go, like, how do you get from that like larger broad concept that most of the people think to kind of this more, I almost want to say niche way of thinking, the way you're kind of presenting it. I love, first of all, like just amazing words, like, just wholeness, full body health, this like true wellness. What I got when I listened to you was this, like all these, like, for me, almost like all these like stimulations were happening in my own brain that was like, oh my gosh, I totally missed that, or I can see that. It just felt like all these amazing connections. And so I'm just curious if you don't mind taking some of us listeners. So like, obviously you go to speech, you get through grad school, you become a speech therapist. What was your journey a little bit? How do you go from what they teach to kind of where you're at? Would you mind sharing a little bit about that? Because it is just a really cool way that you're presenting it and doing it.
Sure. So I really came to this kind of space where I focus on cognition, speech, language pathology, and feeding. I do a lot of feeding. And we'll start at the beginning. When I was in graduate school, before I applied to graduate school, I was trying to think of what I would be good at. I kind of wanted to be a teacher, but also didn't really want to be a teacher. And I felt like the one-on-one setting, I could work on, executive functions and WH questions and all the things that, we think about when we think about speech therapists and what their kind of traditional role is. And I wasn't so different. I had a family member with severe executive functions issues. And I said, how wonderful it would be to be able to help kids that have issues like this, because I saw that it impacted them socially and as well sometimes as academically. So, when I got to graduate school, I became a research assistant for the interplay between specific language impairment, executive functions, all of that. And my research project in graduate school for my thesis was figurative language and how a lack of understanding of figurative language impacts these kids negatively socially. And there was very little research at the time on it. So I kind of dug a hole and I tried to change it. I went back to the chairperson. I was like, I really think I should choose something else. And she was like, no, this seems really interesting. um, so,
We
but
almost took on something that was like, wait a
yeah,
minute, it almost
I
could
was
be
like,
too.
this seems really interesting. The interplay between psychology and how we function, understand theory of minds and all of that. And she was like, yeah, that sounds very interesting. And there was no literature on it. And I went to her in a panic. Like, am
I
I?
love, I mean, I think, sorry, I don't mean to cut you on that, but that right there, I think that is something a lot of people don't, I think like that perfect little explanation of what you just said kind of almost like sums up what that experience was listening to you. And for me, like I'm always, I believe the tongue, like the reason I do the work I do, for a long time, I didn't realize why did it, I was struggling mentally and I had all of this anxiety and this depression. And I, for a long time, thought something was wrong with me. Right. But then when I started to do this work, I realized my body was telling me things this whole time. And I always, when I see parents, I see patients, or I'm just talking, I feel like I want people to know more. And I think there's this like bridge of communication. And I think what you just said, that was listening to you was the first time I was like, oh my gosh, everybody needs to hear her.
Thank you.
So that's really neat. Okay, so you were even scared of your own little path when you embarked it.
Yeah, because I had majored in psychology in undergrad. I toyed with the idea of going into psychology, and then I'm in graduate school, and I have this idea, thinking it was so obvious, and there was nothing. But then, like simultaneously, I'm in this very stressful position trying to complete this research project, and I actually gave birth to my oldest daughter, who had like a 3-page medical history. Along with it was a U-shaped cleft of the soft palate, Pierrot band sequence, and she had like a whole slew of issues, micronathia, but those were focused obviously on her face. And I remember when she was born and in the NICU, she was having difficulty feeding and she had frequent cyanotic episodes. And I have this baby who's turning blue. And every time they come by, they're like, oh, so then you know about cleft palate because I'm like, no, I didn't take that elective course. I didn't, so I kept finding myself in these situations where I'm like, how I'm supposed to know something that I don't know. But that is clearly very, very important. And at the time when she was born, I was speaking to the ENTs, and in the end, they decided not to intervene on those fronts because there were other cardiac pulmonary issues that were much more pressing, and the stability of those trumped some of the other things. But I kept saying, like, why isn't there something you could just put in the mouth, like to help block the milk from coming through her nose and to help bring her chin forward? They kept describing to me this mandible distraction surgery where they would, put these screws in and we would bring her jaw forward. I'm like, it just doesn't make sense. She's so little. Everything is so malleable. Why can't we do it? And then kind of, yeah.
So here you are, one in the most vulnerable situation you could possibly be with your child, having this moment, but all of a sudden and just for people hearing, what's really being presented is that you're already questioning structure, right? So for most of us, right, that structure, function, behavior, you come from the behavioral world, the functional world, but yet you're being presented and asking yourself, why are you guys not, why is there not something simpler for the structure?
Right.
It's just so
why has nobody thought of this before? It seems like she can't be the first and she can't be the only baby dealing with this. So, and they kept telling me like, cleft palate babies figure out how to eat. And so basically it was like her fault almost that she was struggling to eat because nobody could figure out, none of these doctors could figure out why she was having so much difficulty. And me being a new mom and really not fully understanding exactly where I was, like what world I had entered, and being very optimistic and idealistic, as many parents are when they bring their infants, for example, into my office. who have feeding difficulties, I'm just trying to feed her. So they're like, present her with the bottle, use hunger, do this, do that, the whole like all the regular kind of recommendations, and nothing's working. And
And
nothing's working.
almost that industry and where we kind of got to was like, it will, they just figure it out. We don't go beyond what we feel comfortable know it. Like, it's like we don't ever
Eating,
look for the why. Like, we're not looking for the why. It's like, if just here's what normally works. This
right.
is
This
what.
is what normally works. So then
Yeah.
provide her with a rhythm, make her hungry, establish like the hunger satiation. I'm like, okay, so I'm trying all of these things and nothing is working. And we don't think, like, we think feeding is so basic, right?
Mm,
It's
we
such
take
a
it for
basic
granted.
thing that they do it. It's instinctive. It's for survival. So like, not just they'll figure it out, like they instinctively kind of know that they have to do it. And so every parent that comes to my office knows that I will repeat from here to tomorrow, breathing comes first. If they
Mm.
come into my office and they are not breathing well, then even when parents are like, I heard that like you're gonna get my kid to eat, why are you not giving her the bottle? And the reason is because look at your child and how they're breathing. Breathing comes first. That is our number one survival and protective instinct. And we cannot ignore it, or we will not have long-term success. So
That's a big, amazing statement, comment. And it makes me think that like when we tell most parents that there is a connection between picky eating, all those things, and there's a breathing issue. And anyone I know or I have seen that has oral aversions, chewing issues, swallowing, or just really just picky eating in general, it can all stem back to some type of breathing issue very early on when this first introduced. Am I fair to say that? Is that something, or would you say there's a fair
yeah,
amount of connection
and I
there? Or
yeah, absolutely. And I think that the next level, which was years later when I got to the reflux integration work, it kind of just started explaining my life backwards. I took the courses and had initially, when they were talking about big body reflexes, we do not learn any of the reflexes in speech therapy master's programs. We didn't learn oral motor. I had therapists tell me when I first started practicing, like, oral motor is a crock, it's made up, there's nothing to it. And I'm like, I'm using it every day with my daughter and it's the only thing that's moving her forward, but okay. And we were on a cleft palate case together, and this senior therapist was like, you're making stuff up. And so when I started taking the reflex integration courses, it really started explaining a lot of the difficulties that I had with her, and that I identified in myself, that I identified in current clients, and so even though when we learn about big body reflexes and they're talking about body parts that we've never been introduced to as speech therapists, and I always make the joke, like when they're like, okay, so the trapezius, I'm like, is that in the eyeball? Like, I was so lost. They were using so many acronyms, ATNR, STNR. I'm like, I don't know what's happening right now, but enough of what was said was compelling so that I went back and I took another course, and thinking to myself initially, I'm never going to practically use this, but this is fascinating. And then when you learn about Moro and fear paralysis, and you learn about these Moro is our first breath. So when you learn about these components and then you kind of make that, you bridge it to picky eating, and you bridge it to even just a very strong fear for the averse, the kid who really finds food very averse.
for people that maybe know no clue what we're talking about, what is Moro? What would we say in these two responses? What's a
So
pretty simple way of understanding it, maybe?
Moro and fear paralysis are our startle responses, and they are our fight, flight, and freeze response. They are what tells us, are we in danger or are we safe? And when they are in high alarm and in a chronic, loop, we're going to all present slightly differently, but our breathing, our respiratory rate is going to be different. We're going to have pauses, literally freeze. There are kids who breathe and hold and then breathe, and they're holding their breath until, and you see this pattern, and they can take so many breaths per minute. And we see it impacting them in different ways, whether it's just like the dysregulated kid, or whether it's the kid who, has ARFID, and really, whether it's the selective mute, it's it's all of these presentations are kind of, there's a fear paralysis and or Moro component. Fear paralysis is more in relation to sensory stimuli, and Moro is in relation to head positioning and change in the vestibular information we're getting.
What would be some signs if we were to go through just a couple little age groups? So like infants for say, what would be some like very quick things that people could see if one was in Moro versus
Well, that's where a lot of the other reflexes can kind of be very helpful as well. So, babies will startle, some of them will startle and they'll jump, especially to sound. We see some Moro kind of response to sound where they actually actively move their head.
okay.
But these are the babies even in the more mild form, the kids that say, I'm more concerned about potential for just academic learning difficulties or what is going to look like attention, ADHD, or kind of attentional difficulties. Those are the kids who really like they're not acclimating to their environment. They don't necessarily love to be touched by their parents. They're having difficulty getting into a rhythm of eating and maintaining that rhythm. So we see very, very early on, I say a lot are swallowing develops and sucking develops in utero. So when they're already post birth and a parent's calling you and they're like, my kid's like a few weeks old, or my kid was in the NICU, or a lot of these things, I really feel you can almost trace back to in uterine development. If you started asking very detailed questions that doctors don't deem so significant because they have their ranges, but if you ask like, how much amniotic fluid were they at the high end, the low end? That gives you information about how they were sucking and swallowing, even in utero. So sometimes, not always, but sometimes after birth and after that initial breath, which they may have fully taken or not fully taking, after all of these things, I already feel like everyone thinks it's early intervention, but really like this has been in motion. So
for a while. For a while.
So
Is
you're
there
breaking a pattern that's already been kind of established, but you can see like a lot of times this primitive kind of grasp indicates if they're not free of some of these.
For anyone who's listening and not watching us, someone who's holding their the baby fist.
They're holding them inside. So when they're first newborns, this
Okay.
is typical and that's fine. Birth and death are our most stressful moments and we release the highest levels of cortisol. So if within the first 10 days to 28 days, we'll see certain hyper reactivity or certain elements of the reflexes, and they would be in their most primitive state. But then what we see is like they start opening their hands and their thumb kind of comes out here. They start sequential opening and closing of their fingers. We start seeing them play with this, right? Then we start seeing them reach. So if you see, I've seen enough babies that are a few months old, typically developing for, by all measures, except when I take a look at them and look at them even just reflexively, I don't even test the reflexes. I'm just observing their behavior and they're propping, but they're in this position. We need to correct for that. They are not regulating well. They're holding on to dopamine. It's harder. During my presentation, I had everybody kind of do this and breathe in and then open, at least even open their thumbs, but open their hands and open their thumbs, and breathing becomes much easier. If you just hold your thumb in and just hold your thumb out, breathing becomes much easier. So, and this impacts our dopamine regulation, like many components, and take us out of this chronic kind of high cortisol state where we're in constant fight, flight, freeze. Now, if you're in constant fight, flight, freeze, your breathing is not regular, whether you're a typically developing child or you have a diagnosis, you're not going to be a great eater because you have to hold your breath to swallow. So you're not going to hold your breath even for a second if you feel that that's going to be a threat to your system, because we are wired for protection and survival.
So even some kids that, obviously we want our kids to eat, right? So a lot of us, so I'm going to put the parent hat on outside the therapist for a second. And, you're almost like, you're trying to get the kid to eat because you're in this mind, you got to get them to get nutrition. And obviously you want them to be healthy, but just eat, just eat, just eat. And I've had, parents, and I've even experienced where I've had children make themselves throw up because
Sure.
they're, yeah. And this kind of goes back, and I was talking to somebody, and we had somebody on the podcast talking about like reflux, right? Like when the baby gets things. So is there a correlation? Is there a connect, like kids that are still like making themselves so nervous, so upset? Is that kind of in the same realm of like when that reflux kind of happens, if a baby's in that fight or flight kind of response? I'm just curious. We get so many questions from so many people about eating, the relationship, dinner time, and food. And it's really, never mind if you add to a family that, I mean, we're all trying to survive in general. I mean, this can weigh on spousal one
Sure.
parent's trying to do one thing. It really can impact the family dynamic. And then gosh forbid, if you have, two homes or whatever it may be. I mean, it's really dysregulating for anyone, and it can be impact. I'd be really curious to hear what your thoughts are on some of that.
I always just say my second job is like to be a marriage counselor, because it's always like, do you think, I get this, objective question, and I know someone's throwing someone under the bus.
Yeah.
They just want to know who's right. Can you be the tiebreaker? I'm like,
That's when you send a separate invoice for your mentor for
yeah.
moderating.
Yeah. Yeah. And sometimes, in all seriousness, like I do feel that either parent or both parents really do need to kind of sit down with a mental health professional to kind of work through their own feelings as it relates to this complicated, difficult dynamic that's at play. Yes, but to answer your question, I think there are a number of like biomechanics at play. So I think about certain elements as if you take a look, say, at a kid with a diagnosis with a syndrome, and many times they're low tone. And so you think about tone and then the positioning of the sphincters, which are the valves in between. There are a number of sphincters within our digestive system. So if you think even of just the lower esophageal sphincter between the esophagus and the stomach, and how that's resting, and whether it's slightly open, not open, whether the muscles are functioning as well as they should. But then you think about the biomechanics of the diaphragmatic movement. The diaphragm is obviously important. I tell parents this all the time. We all know the diaphragm is important for breathing, right? Like anybody who knows anything about the body will say like, oh yeah, sure. Okay. And we all do that science project where you pull down and the balloons inflate. And so yes, the lungs fill up with air if we're doing proper diaphragmatic breathing. But the other piece is that we know there's so much coming out about our gut being the second brain, and this gut brain connection and this emotional response with our gut is constantly, they're finding more and more research about hormones, our immune function in our gut. Like there's so many different things that our gut does for us. But what helps with that peristaltic movement of the esophagus and the movement through the digestive system is the diaphragm. The diaphragm is
Better
plays a
breathing.
very critical role. So if we think about that, and we think about someone who's in high stress, who's throwing up, who's literally like purging because it's so noxious for them. Yes, I think like that's where it gets a little bit more complicated to explain to parents, because they want very concrete answers, and sometimes it's a little bit complicated to kind of say, okay, well, we have this highly anxious child. Their respiratory rate and their rhythm and their diaphragmatic movement is already much more rigid and limited when they're eating. If you watch them carefully, you can see like they're looking at food, and that's the sensory stimulus. Just even looking at, SOS feeding, even some of the other approaches to feeding will focus on this sensory based response, and vision is the first thing they see it. So
They will create a relationship.
Yeah.
It's funny. You talked about your daughter. My son, he does not have a diagnosis. He's outside of our dinner house. And if you didn't know myofunctionally from his narrow bite and all those things that we've worked on, you would think pretty much, but he has extreme breathing issues, extreme allergy. I've had him tonsils. I mean, if he doesn't do a saline rinse once or twice a day in the morning and night, because he plays soccer and he does things. So for the most part, he doesn't look like a sick child. But if he's clogged and he's breathing, food has no flavor that he really likes in general. So of course, what does he want? He wants sugar, candy. Like we want things that have a quick thing. He's also exhausted because if he had a bad night's sleep because of his allergies, this is a kid that has warm. He's had expander. He's done all the things. I can get him all the resources. And I almost kind of selfishly asked the question, my husband, old school Italian family, he's like, the kid needs to eat. and and I can see the moment when I put on that table, I see his eyes. When you say that, I see his eyes. He has already made the decision. The moment I tell him, he looks, he sees it. I can tell what it's going to happen at that dinner. And my husband will look at me. He's like, you cater to him. I said, no, I'm not trying to cater to him. But it's this crazy connection, and it will create big feelings because I got my husband who's this, my son wants to please. He wants to make everybody happy and then we all want to do our own thing. And I just think for parents, like you said, I think it's really great what you just mentioned about the conversation really has to always start with me and my husband, and that requires us sitting down. And then the worst thing, what do we do? You compare from other children. Your sister doesn't do, or my husband's favorite one is all your friends are eating at their houses, like he has any clue what's happening at anybody else's house. And just to kind of let the listeners kind of laugh that this is complex, but yet there is such a human element to this. And then like when you go back to the psychology is in everything that we do.
Everything.
And this body of ours, and then you connect like even these big feelings like shame, embarrassment. And I don't know about you, but when I get embarrassed and my mouth goes dry, my whole body clenches up.
Yeah.
And you think that these little bodies are keeping the score and they're remembering all those things. And sitting during your presentation, and for any, Dr. Barry's office in general has a very child feel for me. And I make a joke, it's probably because it still looks like it's in the 80s. And that's when I was a child. And I told him that with love. But it brings the inner Melissa out, that little child in me. And when you were talking on that, as the adult, it was like, ooh, I can't help my son until I really feel my own child issues and I think a lot of parents.
His fear paralysis is activating, right?
Yeah.
And that's setting off the reticular activating system. It's setting off so many messages in the brain. Like we are in a state of high alarm, like be on alert. And I always say, like, if you feel that you're in danger, you're not thinking about your shopping list. Like if you really feel like I'm in danger, someone's following me home, you're not thinking about the mundane or the to-do. So what happens is they're going into high alarm. You are observing him. You're going into a high state of alarm, yes. Right? And then all of us, I mean, like I really can empathize with your husband because I remember sitting there with my little infant going like, but just eat. Like, I don't understand. This is your job. This is your whole job is like to eat, cry, and have dirty diapers. Like, what is happening that this is so hard? Everyone keeps telling me this is what you should be doing. And to the point where like the doctors wouldn't put in an NG tube. I had to advocate for her when she was 8 months and say like, I am done changing this NG tube. I have to literally sit on her to do it. I'm terrified for aspiration. I don't think this is the best thing for her. It's touching so many structures in the back. It's so negative on so many levels. And I said, like, that's it. And that was its own kind of disaster, putting her under anesthesia, but ultimately was the best thing for her. She didn't really start eating until she was older than 2 years old. So, wow. I mean, could you imagine, like, they were so completely wrong. And I sat there literally sweating and couldn't figure out, like, what am I doing wrong? And why is she was such a sweet, sweet girl and so compliant. And so she was sunshine. And yet in this area, I was like, like we're at war and I want to win. I'm competitive and I'm being told that I'm right. So like you need to eat. And so I always tell the parents when they come to my office, If your son at dinner has already determined that he's not eating, my
Yeah.
money is on him because they
Which
have never ending energy. They are fighting for survival and they don't have to worry about the bills and everything else. So, like, when a kid is refusing and a parent's like, you see what I have to, I'm like, okay, but if you're going to choose to fight about it, my money, I'm going to bet on your child. They will always win out because you are going to make 500 different meals. And I would do the same. And I have done the same. You're going to make 60 different meals to try to figure out how to get them to eat and give them 100 different options, which psychologically is so confusing for them. So keep the options fewer than greater. And, it's okay to say something else, but then it has to end somewhere. And it does create like this chaotic kind of environment where nobody really knows what to do. And it's very hard to really understand where it's coming from. So when I'm looking at it from a breathing perspective, when I'm looking at it from a reflex perspective, all of a sudden everything kind of makes sense. And then it also makes sense why these kids have the narrow palates. They're breathing so shallow. And what came first? I mean, we need to address it no matter what. So, but these kids with reflexes that are out of whack are more prone to allergies. They are. They're not getting rid of toxins readily from their system. They're not activating the Perez reflex, which involves the spine and flushing out the system. They're holding toxins even in their joints, which we are learning more and more that like this also contributes to immune function, also contributes to fluidity of movement. So when we're going back to the biomechanics, these kids are the kids who are getting injured all the time. They're constant injuries. Like they could be very athletic, they could dance, they could do sports, but they're the kids who they're locking their joints as a compensation. And we can have negative compensations that strain our system, or we can pull on positive compensations. And because none of us are perfectly integrated and none of us are perfect. So I always say, as much as it bothers me to say that I'm human and I have limitations, it's very factual. So I don't have 8 arms like when I'm doing a feeding session and the kid's throwing everything on the floor. And so, there are certain things that I'm going to have to let go and teach the parent to do because we weren't built like that. We're just not an octopus. So there are certain limitations and we have to recognize it within ourselves and then recognize like where can we gain control of this train? How do these things come together? Where can we bridge it? But we start seeing these patterns of the narrow palate, the shallow breathing, the upper thoracic. We start seeing that, yes, if we take care of the adenoids and the tonsils, how many parents will come in here and say, okay, I heard that if I just do a tongue tie with my infant, then they'll start eating, everything will be great. And I say to them, could be that if you do the revision and with the body work, like they're willing to do the body work before and after, they're willing to do the reflex work, but then they want to stop. And I say, your baby's going to let you know when they're ready. And you setting arbitrary timelines is not going to work in the long term. It may work now, meaning now you may get away with it because they may start eating after the revision, especially if they've had some work done before and after. The frenulum itself can inhibit the reflexes. If we have a midline issue, we won't be able to get full trunk extension. We won't be able to get full integration of some of these patterns.
Let's like highlight that that's actually really great. Right, tongue ties. Everybody loves a quick fix. Everybody wants the
magic pill. Yeah,
everybody wants the magic pill, and I get it. I'm American, like the best of them, right? I want. I say to everybody, I'm not shaming you. I'm the first one to. I get it. We're all busy.
I'm in line. Yeah,
exactly. And I'm so grateful for the research and the movement that we've gotten behind tongue ties. But again, it's one little tool. It's one tool. And I think people, fascia, they have this, and especially my hygiene folks, my dental folks, we love our mouths. That's where we feel comfortable. That's our home. And we're like, ooh, frenulums, we can do that. We raise our hands. And even my myofunctional, all my hygiene myofunctional people love all of us. I know we have our own specialty, but we can get real hyper focused on just what's happening from the mandible to the maxilla and what we can see. And I'm pretty sure I'd love for you to go deeper into this, is that I'm always like, most of the time, if you have a frenulum issue that I can see, I mean, that's like, it's like you're hitting the iceberg. I mean, it's like the Titanic. Like if it's a grade 4, we got a lot of other things going on, but it's always the stuff that's way behind it. And I'm really love for people to hear how connected it is and how much it affects from all that feeding up to it. And that it's so much more about stretching and integration than it is about releasing. So yeah, I'd love for you to kind of go down the little fascia frenulum conversation about how it affects and impacts what you see in your work.
Going to try to unpack it as best as I can, but we know within the myofunctional research they always show kind of like the connection of the muscles from the tongue all the way down to the big toe, and so that's kind of my starting point for even explaining some of the reflex work. So when people come in and I say to them, "You're going to see me working on different parts of the body." And it may look funny, like, why am I working this kid's foot when I'm trying to address feeding? And the answer is because what happens is what we tend to see within the myofunctional field and within breathing, we talk about postural changes that happen as a result of a narrow palate, difficulties breathing. We're compensating, we bring our head forward, we have internal rotation of the shoulders. We also tend to like grasp a little bit with our feet. Our big toe doesn't have full range of motion. Our big toe, you should be able to stretch it pretty far up. And so what we see is whenever there's a tongue tie, I go straight for that big toe. I want to see like, what is our big toe doing? Because that will explain some of the guarding response in the body. It's automatic, like internal rotation is our guarding response. So when we're talking about going into negative protection state and kind of withdrawing, we are all of these, again, we start seeing all of these trends and relationships and patterns. And so it's not so surprising when a kid walks into my office and I like, what's more surprising is when they don't have tongue tie. Like they come in and they're like a mess. And I'm like, I don't really see such a big thing to do there. But that just kind of reinforces this idea that I really believe like timing is important, assessing the global functioning is important, maximizing what we can get from, from a myofunctional perspective and from a stretching and a fascia perspective. I didn't mention it before. I do also do some CFT, but generally like I'll be working with a craniosacral therapist. So all of this is great to release the fascia and to move forward. But sometimes I get the kids who come into my office and the argument has been made against this. I'll go into it in a second of like, well, if it works for most babies, then why would you not recommend a tongue tie release right away for all babies that walk into your office? But I've seen like real disorientation with the revision where they go into straight fight flight mode and they completely shut down. And I think the reason for it,
it's just too traumatic to the system. The body's already too overacted. You're going in, even though nowadays with lasers and things like that, it's still too invasive to the central nervous system in a sense. And the baby's just not,
the parents have to go in when they're screaming. And many times they weren't trained necessarily properly before. So they're the first time I always say to the parents, like, just get in your kids. If you want to go for a revision, get in your kid's mouth now. Make sure you're getting comfortable. Get comfortable with their mouth. Don't do the revision and then go, okay, now I'm going to do the exercises.
Yeah.
That will be very hellish for everybody involved.
Even, from a training standpoint, I mean, in therapy, before anybody's going down to release, I'm like, I was stretching my own tongue, showing somebody before the release. And all of a sudden I stretched it. Let me tell you, I almost ripped my own, I was like, oh, but you need to feel what it feels like to get in there and get invasive. It's uncomfortable for a lot of people. They're tearing in their eyes. I mean, even as an adult. So imagine what that's doing to a little central nervous system for certain people. And I think a lot of people don't think of that. I think it's a really amazing point. And I think the more people can get comfortable with their fingers in their kids' mouths and experience that. And I want to say, I think a lot of doctors that are just doing releases, again, I understand that we all want to help, but even if you do anything, make sure that parent can practice for a couple days before, or at least a day or two before getting in there before you go and do that release. I think it's a big what are some really big things that you've seen of these kiddos that have gone into like a shock afterwards?
So, I mean, it ranges, but in the most severe form, they will. I mean, the whole point of doing it was to get them to be a better eater, and they
Mhm.
won't eat.
Oh, it
Yeah.
actually stops them almost completely.
Yeah. They won't eat. It's very difficult. And then if they do eat and you can get enough into them, then they don't transition well to the next stage because we haven't assessed kind of lingual competency in these littles. We
Mhm.
just haven't, we've kind of overlooked it. We just assume it's going to follow. But some of these kids have no concept of the roof of their mouth. And the second I even so much as tap there, they gag
Mm.
because they don't know what that is because their tongue was never resting there. They're not familiar with the sensation. And so their protective response is, I need to get this out of my mouth.
Yeah, gotta
And so
gag. You
we do
gotta
that. We gag. They don't know how to
Mhm.
spit out. They don't have movement patterns. The tongue is the only muscle that moves in all six directions.
Ah, that's such a good
It's
point.
huge.
Yeah.
It gives our body so much information about where we are in space. And our entire visual auditory system develops based off of it. We root that changes our visual gaze, then that changes auditory information that we're getting. It's in our inner ear. We have the vestibular reflex, we have the auditory reflex, and we have the oculovestibular reflex that connects our eyes to our vestibular system. That's why when we're running, we don't see that movement that we would see if we were running with a camera because it stabilizes the image on our retina. It sends a message like we are in motion, stabilize that image on the retina. So if we think about the beginnings of development,
Mhm.
swallowing in utero, sucking in utero, then birth, and then all of these components, and then the rooting reflex and for protection and survival. And then we think about the visual auditory system and how it's developing. Other than, again, the mechanics at play, like every time we swallow, we're activating the vagus nerve. Every time we swallow, we're equalizing pressure in our ear. Every time, right? So then the kids who are chronic fluid in their ears, that's further impacting their auditory and auditory processing systems negatively. So if I feel like, how are we overlooking the mouth? But then when we also can't, it's dangerous. It's a slippery slope to then view it as a magic pill also, because we do have to figure out like, where is this kid functioning right now? Because even though it's a tether, sometimes the way I explain to parents is sometimes that tether is an actual anchor. It's anchoring
Mhm.
this kid in space. So even though it's limiting their movement and they can't tolerate tummy time as well as the next kid because they can't get into full extension, right? Because they literally have this tether pulling them down and maybe they're have more internal rotation of their shoulders, we have to assess whether or not they can move their tongue in different directions. If there are plenty of kids who have a tongue tie who, and plenty of parents who say this to me, they're like, yeah, but do we really have to do it? Like I was told I have a tongue tie and I'm totally functional. My first question is usually like, are you?
Yeah, exactly.
Like,
Which
pretty sure
which goes
nobody is.
yeah, most of us I mean, that's something we hear a lot, right? Well,
Yeah.
like,
Mm,
yeah, I was sitting with a parent a couple days ago and just 3 kids and I'm the older she was okay with the older, but you could tell she was exhausted. She, like, didn't wanna get into it with the middle one. And then she's like and I said, "Well, Mom," and she goes, "Well, I don't" is she the mild tongue tied? Well, she's only a little tongue tied. I'm like,
yeah.
"Well, there's no real" I get it, Mom. And I said, I hope you say that. I hope I'm saying this with kind of go, but you're tongue tied and you're probably thinking in your mind, I'm functional. So why, and that was such a, and she looks at me, she goes, yeah, I think that's exactly what I was thinking. And then I look at her, going, kind of in a nice way. She goes, but then I think to myself, like, I'm also a real mess. I said, okay, which when we first started and we kind of jumped in and I had said to you that I tend to like want to always I love this connection that I feel like if we can, I'm a big fan of healing our inner child wounds in general. And I think we do it. I think society, we're very open now to discuss about what happens as a child. We might have to parent ourselves again, or we might have to do that. But is there an opportunity to re-support us as like primitive reflexes? So as a parent, we can even notice maybe some of these areas that we didn't hit as a baby so that we can support our kids better? Or I'm just curious what your kind of that full circle take there, just saying like, what do you say to a parent that goes, I'm functional? And you're like, are you?
So, once I've established rapport, I'll say, listen, I'm not asking questions for a response, but just so you can start thinking about, are you more anxious? Do you need certain control in your life? And because I can get enough information from observing their movements as well to know, like, oh, maybe these reflexes aren't integrated so well. And this is with the reflexes, they express themselves cognitively, sensory wise, motor, and emotionally. Like there's a correlate for each of those domains, which is why the reflex work can be overwhelming to understand and to explain, because not everybody's going to present exactly the same way when their certain reflexes are impacted. And we also have different phases of the reflexes. So depending on how developed they were or whether or not, they were able to physically transition easily in and out of crawling, for example, will correlate to like flexibility and thinking. And these are much more abstract concepts to explain. But in being able to observe the parents, sometimes I can say like, well, and sometimes they'll tell me like, oh yeah, I've been taking anti-anxiety meds my whole like adult. I cannot. And I'm like, all right, so we want better. Or I had a parent say to me like, I mean, he goes to bed really late, but like, I don't know, I was never a good sleeper and I'm a functional adult. And I said to him, I did say it straight. And I said, but are you? You have difficulty getting up every single morning. You're
Mhm.
always tired. You get everywhere late, right? And you know
Yes.
it and you accept it about yourself, but that doesn't mean that that's okay or that's ideal.
It's not
So
ideal. Yes. You're working harder to
yeah,
do
you're working so
very.
much harder to function. So you're
Mhm.
telling me you're okay. And, maybe you're taking ADHD meds, maybe not. Maybe you're taking sleep medications, maybe not. Maybe you're trying a combination of an herbal root or, natural, more homeopathic remedies. But many times, many of these adults have resorted to medication and there's no judgment. It's just, are you being fully honest with yourself? And the next question is this good enough for your kid? Because some parents
Mm.
will tell me like, yeah, I don't, it's fine. And I'm like, all right. So then then that means that they're just not ready. And at some point, if their kids are on long-term medications, their livers are going to catch up with, like, there's going to be enough that it's
Oh,
not going to be
it's
working for them long-term. But I
not.
also know that I can't convince everybody and not everybody's ready to hear it and not everybody's looking for that information. So
Which I think as therapists or healthcare providers, we all listen. I remember when I first went and got into this and I like saw it, like I couldn't unsee it and I was upset. I mean, I would bully people like, what do you mean? Like I could, because I want, but it was coming from this place of
sure.
like wanting to help, right? And then add a little New York, New Jersey on us and a little,
Right.
and it could come off a little aggressive or
Aggressive.
a little bit but it was because I ended up in a very, I guess I'd like to say the word intense conversation with my mother and about some of the situation. I could tell my mother, like, that we could go with, that's a whole other episode, but another, you know, and I could see myself getting like a, almost defensive, argumentative with her. Like, you made me believe it was me, like I was a child. And all this sudden later on, I was in this kind of like group setting, and I realized that my mother couldn't even, she wasn't even capable of even thinking outside of survival as an adult because of some of the things that she was going through. And I remember sitting with that and just like having this moment of like forgiveness, like almost like, oh wow, she didn't even have the ability to think that I could do more or what was even happening. She couldn't even understand that. And then I later on ended up having a couple family members, or I was doing a consult, and I naturally would probably I would be a little like blunt about what I was thinking. And I stopped with myself and I looked at the parent and I thought, the best thing I can do for this family is plant seeds, meet them where they're at, give them some information, not try to get them into therapy at this moment, give them as much free resources and find something that feels digestible for them in that moment. And it was such this unique, it was just a different approach. And I realized in that moment, that family later on found the right resources and wherever it needed to be. And I had this big moment of gratitude of recognizing that my own journey and having that moment for my own mother of her not, it was easier for her to just assume that I was a tough baby or that I was struggling than she couldn't have wear that maybe she wasn't able to identify what was going on with me or wearing some of that. And I think there's a humility in that where a lot of parents and a lot of moms are just, and parents are surviving. And here we can all sit in a room and be like, well, it's this and it's this and it's that. And that can be a lot to go home to families and add some mother-in-laws and, some financial issues, mother. I don't know if you experience this. I have a lot of moms tell me their mother-in-laws are really, I don't want to say obstacle, but so many opinions. And then especially a mother-in-law that's really close with their son. Oh, I thought what I would do, really laying on another layer.
Don't give them food. Don't feed her. And she's
Yes.
going to eat. And I'm like, how'd that work? Did you try it? I'm like, my money goes on that child's not going to eat all day. And I pray to God they don't end up in the ER dehydrated.
I really, what you said before, like the money's on the kid, right? Like you got to really go with that. And I think so many people and parents don't always see that because this is a very complex conversation. Like these are complex, overwhelming concepts sometimes, but yet they're so simple. Like there's this it's even contrast to light and darkness of this own conversation, right? I mean, and here you are in this place with so many families and parents. So this is just really, so what are some practical things like, that we can give some people and some listeners and people to take away from these things? If I would say to you, like, what's your magic, what do we want everyone to walk away with? What are some of those things that sit with you there?
So I think a few like key core components that I really hope that parents leave my office with, and in general, people who I speak to, is that first of all, there's more than one way to reach an end goal. So I had a parent in my office the other day saying a friend called me and wanted to know what I should do. And I said that she should call you, but she travels a distance and her friend doesn't want to travel a distance. And I was like, your friend's not ready. And she said, I thought about you and what you've told me, because whenever I speak to people, I try to convince them that this is the way to go. And you always tell me, don't. Give them information and give them a way, any way. So she said, well, then what should I do with my friend? And I said, give her this therapist's number because your friend is willing to seek out OT. This OT knows who I am. So she'll have access to me and can ask questions. And I said, but we need to start where they're at. If that's what speaks to them and that makes sense to them, then you can go in that direction and start there. But my main thing is that it's this tough balance when you're talking about your mom and you're talking about your relationship with her. I feel like also the other piece is, when we're surviving, our executive functions are offline. We don't have capacity to really think clearly, make very good decisions, and think in a more organized state. And so we have this kind of shut off and we're just go and doing whatever we can if we're able to just keep going, right? Like some people really do shut down and freeze. But I think the other piece is that parents feel that it's like either my kid is difficult or it's my fault. And it's not your fault. Like, this is not like, I'm not trying ever to dump it on someone or project onto someone and make anyone the guilty person. I always say here in this office, we don't play the blame game. I'm not interested in who, what, where. And even within the reflexes and all this, I say we don't know for certain. I can have very strong, but to say that I definitely know would be a ridiculous statement because there's so much that's happening in intrauterine development up until now. But what we can say is that here's what I can do about it. And here's where it doesn't have to be like my fault, and it doesn't have to be the baby's fault. It could be that this is the scenario that we're dealing with, and we have to recognize that we just don't have the tools. And I think that that makes us feel less than, especially when we get into complicated family dynamics, neighbors. And I always make the joke, like, I'm going to write a book one day because I went through so much with my daughter. And I remember everybody had the answer for me. Like, and it was always very simple, like just pull the NG tube out and it's okay. Just put her on oxygen and then she's going to eat. And I'm like, okay.
Yeah.
And so when parents even present this to me as an idea and they're like, you're going to tell me, and I'm like, what? I'm curious to know what I'm going to tell you. I'd love to hear it. Because usually it's not what they expect. Usually I say, if you want to try it, because you
Mm.
need to know within yourself so that you don't feel defensive when you're going back to your mother-in-law or your neighbor, but be intelligent and be protective. At the end of the day, this baby needs hydration. I'm not going to condone it as a professional that this is the
No.
right way to go. As a human being, I understand it. As a human being, I really understand this need to try it and see, like, if everybody's telling me that this kid will eat, but like, you have to set your limits and be very, very clear that it doesn't go beyond whatever it is, whatever those number of hours. And I always tell them, like, and you should be telling your pediatrician, you should be telling your GI, and they can not like it and be, tell you that they don't approve of it. And that's just fine, but they should be aware, because we don't want to end up in a situation where this kid is decompensating completely. So oftentimes, like, they're a little surprised, like, that I say that as a person, as a mother who's been through feeding issues, I fully understand it.
You can recognize there's a human level that, like, when you have a lot of outside noise, you have a lot of people coming to you, it almost becomes a little confusing. You know what to do. And you have this
Very
precious little,
confusing.
right, this precious little life.
Yeah.
And ultimately it's that we talked about the gut brain connection, right? And that gut brain connection is like, my brain saying one thing, my gut and my heart are saying another. I have all this noise coming at me. I'm probably exhausted.
Exhausted.
I'm depleted, and that natural instinct goes into. And when you have an extreme case in an extreme situation, it requires a lot. And I think we can everyone. But the proper thing to say is this: when you are in any extreme situation, extreme yourself, extreme baby, you need drones. You need other people's eyes that are educated, not
Right.
attached emotionally to the situation at
Yes.
all, because you need people that can think clearly
Yes.
and be on top of things.
Yeah.
And I think as a parent or as anybody, you need to know when you are not your sharpest,
Yes.
and that most likely the people around you, if they care about you, they love you, or even if they don't love you that much,
Yeah.
like you that much, there's a connection there, and nobody's making logical decisions
No.
in that moment. And so you do have to trust the people
Yes.
that they can make decisions coming from a very non-reactive state.
Right.
And I always say, like, why do we love that overview picture? It's because it's a totally different perspective. They're looking at it from such a different eye, and usually they're going to catch something that you can't see in that moment. And that's where the trust has to come by. And trust is a very unique and special, development process as well, that not we all have different levels with trust, rooted in fear, rooted in all of these things. We don't want to fail. We want to all succeed. And I think when especially us as professionals, we get into these conversations, we get in these rooms where we're educating and we're teaching. And I think there's always this general consensus. Everybody wants to help in general. I don't know, I'll listen to parents say, well, this doctor said this or this. I go, I promise you, nobody went into this field to hurt people. We all do it because we want to help. It's just, there's many layers to it. And we're all trying to meet everybody and meet where they're at. And there's a lot of opinions, but at the end of the day, there's nothing like mom intuition and that ultimate feeling of take a deep breath. It all goes back to breathing. Breathe a little bit, get centered, turn the noise off a little bit, and sometimes just reassess the situation. It can be the answer to everything, whether it's, adult myo, anxiety, depression, feeding, all of these things that we all assume that the human body should do easy, right? Eat, breathe, we take for granted. I said, just because you're walking down the street doesn't mean you're breathing easy, buddy. It just
Right.
means you're getting enough air to keep your organs going.
Right. But you know what I always say to parents is like, especially when they're coming in this exhausted state, but especially when they ask, also when they ask me, if it's so important for their kids. And I say, listen, sleep deprivation is a form of torture for good reason.
Mhm.
It's,
And
it's
it's
real.
it's amazing. And I remind everybody is like, our bodies are, I mean, whatever you believe in, this is a heck of a machine, man. It is not common not only to grow, but maybe even thrive in horrific settings and situations. This beautiful monkey suit that we get to wear that's connected is it's a piece of art. Every one of us. It's just absolutely fascinating. And I'm always in awe of how the human body reacts and what it can do. And I always say, your body doesn't want to hurt you. It loves you. It's trying to figure out the best way to protect you and to support you. And right now, it's like, it's doing this for a reason. We just got to find a way to soften the situation and try to relax it. I said, your body's not out to get you. I promise.
Right.
It's it's
And
just
and
obvious.
it needs some structure and rules. I feel like some, some principles that we're following, at least guiding principles. And I feel like, especially when there's like a severe feeding case, the parents are really like not just functioning in chaos, but part of the difficulty in trust is like, but you're making it sound so simple. Like you're
Mm,
making it sound, all these providers are making it sound so easy. So they're saying if I switch the nipple and if I do this and I change the bottle and whatever, everything's going to be better, and everything's not better, And I think that the most important thing I can do is to let them know, like, listen, 100%, as much as I don't need to go into my own story, but I've dealt with this personally and professionally for very many years, and I really understand both sides of it. So tell me, like, what is not working for, what are you struggling to implement? Because your baby's just responding. That's what's happening. It's part of their developmental stage. You're in the sensory motor stage. They're just responding, and that's what they're programmed to do. So they're just responding. So what is it? I just tell me honestly. I didn't do this. I didn't do that. And that's why many parents will admit to me after the fact, like I pulled the NG tube, and I'll say to them, listen, I would not try that again. I don't think that's good. But you have to set up parameters in advance, because it can be very dangerous. And the main thing is your baby's then going to respond, and we don't want to further this negative response. We don't want to embed it and anchor it and re-anchor it so many times that they really think like this is a very unsafe situation. Every time this bottle comes to me, I'm not safe.
well,
Um,
we want to create safety for
yeah,
babies and for people.
we all need it.
What if
So
we
I think
create, oh,
the
sorry.
main thing for me, when you asked me the question before, when a parent or family comes to me, I try to really address it, not even from a reflex perspective, not even from a myofunctional perspective, but much more from like a bonding perspective. Are
The
we well
bonding,
bonded? Right?
yeah.
Because what is feeding, speech and language, what's communication? This distinguishes us from all other beings, right? Where as humans we have unique abilities, and when we're communicating, we are relating to others. So this element of feeding when we're first eating, and regardless of how, usually for sure with breastfeeding, but even with bottle feeding, we're usually holding the babies close. They're picking up on our respiratory rate. They're picking up on our heart rate. They're picking up on a lot of other information, and they're regulating. And this is what they're using as their basis for regulation. And then as they get older and they understand the underlying kind of cause and effect and social pragmatics, and that they can advocate for themselves and they can request food, and then this whole back and forth of getting that positive reinforcement and the smile and the hooray from mom and dad and caregivers. I think like this is such a huge piece, so that when people come in, we have to understand like this is foundational. Our ability to bond and bond well if we shift focus off of just a little bit. I'm not saying the oral motor is still important. I'm not saying we can
Yeah,
just
no.
ignore all these other things. And this is what I tell the parents when they've gone to other providers and they're like, but she told me, and I'm supposed to position her this way. And I'm supposed to, I'm like, you're supposed to enjoy her. Like, you're supposed to enjoy your baby if he's doing this or he's doing that. And all you're thinking about all day is getting in the next ounce and the next calorie and the next, your entire focus and the entire paradigm of the relationship has shifted.
Well, you've changed the dynamic and now you become a little bit. And I think I want to just touch on something you just brought up and about how feeding, connection, communication, how they all connect. And one thing working with a lot of adults and older ones, one thing I have noticed is, and we actually have a disclaimer now in our consents for adults that if we're doing therapy with them, if they start to feel triggered or like they don't want to come back to therapy, like they want to cancel or something, we tell them that they have to wait a certain period of time and then they have to have a conversation because we did a bit of a test. And what I noticed with most adults was the moment we got into certain areas, it would create inner child feelings for them. And it was like 9 out of 10 were always connected. I had 4 adults say to me, you know what? All of a sudden you were making me feel like the way my dad made me feel at the dinner table. Or all of a sudden it brought up this insecurity about how I don't really like to eat in front of other people. Or I eat really fast, then I'll talk. Like that relationship from eating to communicating to connecting really goes where, you obviously when you're a specialist, unfortunately you get that percentage, that 1 to 5% of really extreme cases. But when I first asked the question of like, as a speech therapist, how do you end up in this really great niche? And I think you tied it together so beautifully is that feeding, connection, communication, the way we speak, the way we present ourselves all comes together. And I think every therapist is trying to coach and connect to that. And it really, from a myofunctional standpoint, moving your tongue, the way you chew, the way you breathe, the cadence in all of that is really a huge component of how you show up in the world and how you present and that posture. And that I think that's related to anybody who's in the airway space. And I'd love to, with these kiddos or anybody who's just having food relationships, do you see when then maybe the way they'll speak, I speak fast to slow. Do you see any connection in those things? And just overall of like when you bring it kind of all full circle, see what your thoughts there.
So when I get calls, I just want to work on R's and L's. There's some fluency, and I'm like, okay.
Yeah,
Um,
I
so
love
if
that too.
they're really insistent when they call, and they're like, I'm just looking for my functional therapist, and I heard you do my functional therapy, and I'm like, all right, I'm never sure what their perception is and what they've heard, because generally, I would say more and more parents are informed about what I do, but generally, like for a period in time, and even now, people will just go, I heard that you do, I heard you're excellent feeding there. I'm like, thank you for the compliment, but do you know what I do here? Like, do you know what happens in this office? Because I know if they're calling for R's and L's and myofunctional therapy, they have no idea that I am literally all over their kid's body. Like, they're going to come in and be like, what is happening? So that I'm going to be working on posture and I'm going to be working on all these other elements. But yes, I find that oftentimes, whether or not they, let's say, came in for our tick or for feeding, or it's more of a social pragmatics, my kid gets anxious and can't find word retrieval issues, however the parents are describing it and relating it to speech therapy.
Mhm.
I find that typically there's, and I always say the people that need to find me, find me. Like if they need to be
Mhm.
in this office, they're going to be in this office, whether they call and they say my kid has a lisp, or whether they call and they say my kid is super anxious and can't function in school and can't focus on anything. And I was told that with this element of language, processing, like you're good at it. And so that's my general attitude is if you're coming in here, then generally speaking, there's a component that has been interrupted in bonding. There's a component that there's a thread, and where we're not, if we're sometimes if we're stuttering, and it's not necessarily true stuttering the way that we're taught in graduate school, but there's a poor alignment of all the resonators, and we don't have good posture, and our tongue is not. And we know from myofunctional therapy that sometimes we just need to work these muscles and hitting our targets more smoothly. We need to work on that motor planning, strengthening. So for me, I feel like I see it all the time where the kid has one issue, and then we very clearly see there are a whole slew of issues.
All of a
Um,
sudden, the other stuff just highlights. You just right? It's like highlighting the dysfunction. You just
yeah,
can't not see it, right?
yeah.
Which
So,
is
and so,
helpful to unravel for the parent.
yeah. And so then I'll say, well, you're coming to me for this, but is your child, what kind of foods does your child like? Do they like, more processed foods, chicken nuggets? They're like, I'll say, do they eat protein? Yeah, sure, they eat chicken nuggets.
Mm,
And I'm like, okay. So, and then I'll try to show them the patterns like this. So I want to prioritize the treatment plan with the parents. We have a lot of tools to work with, thank God, here. But at the end of the day, I'll say, like, but look, if you evaluate their sleep patterns, how frequently they're urinating at night, whether they
mm,
have enlarged adenoids and tonsils, how narrow their palate is, whether there's a presence of a tongue tie, what their food preferences are, their attention and focus in school, and then whatever we're understanding to be their auditory processing or their language processing or their executive functions or whatever it is. And then we look at R's and L's, and disfluencies that we're seeing. There's usually like a common thread. And if we can kind of get the system on board and then bridge it with tongue strengthening and motor planning with the myofunctional, if we can bridge it with, a meal plan where we can start introducing new foods, and we can bridge it then to traditional speech tasks. When I want a kid to answer WH questions or retell a story, I'm going to have them do cross lateral big body movement in order to then get them in a more organized space. I want to activate right and left brain. And so I try very hard to make it as concrete as possible. Um,
mhm.
when I'm explaining it to parents, like, this is the way that we're going to set it up. Everything is set up in a hierarchy, and this is the homework. And I tell them, like, I could give them very complicated, very long homework. I view myofunctional more as like boot camp. And sometimes that doesn't work for every family simply because it's going to impact bond. Like, the mom's going to get naggy and the kid's going to shut down, and we're going to have this tense relationship. And did you do your homework? And you need to do it, or else blah, 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 blah. And these things that are not meaningful to them, like your teeth are going to, I had one mom come in the other day. I told him that his teeth are going to be crowded, and he said he doesn't care. And I was like, yeah,
That's
why would he?
no, why would he care? Exactly.
Like,
Because
he's
it's
9. He doesn't care. So,
fine. Yeah, I mean, 'cause even I mean, like, they've done so much kids don't even care about themselves in 2 years. They can't even cognitive
right.
think about who they will be in the future. And I think it goes back to us trying to coach and bring awareness and development. You gotta meet parents where they're at. And I mean, it's really powerful just hearing first of all, let me just say, I'm so grateful to hear you talk that there's hope for these families and these parents. Like, I think a lot of times people can feel really defeated and I think one thing I'm hearing from you and what I got out of you is like, there's hope. Like, there's definitely a way out. And it sounds like even your own journey, because you lived it from a parent side. And now, obviously you've been doing this as a practitioner and a provider for so long, it's possible. Like, it's not the end of the road. There is a light at the end of the tunnel. And I thought that was like the most, I loved hearing that because some of these times can feel so daunting and so lonely. So with that being said, I'd love to ask, so for some of our therapists out there, I know the question I'm going to get right away is, do you teach a course? What do you like? Do you offer different like, what do you do? Because I'm sure I'm going to get blown up. Where do I see her? Where do I find her? How do I learn or at least know how to screen? What if people don't live by you? Like, tell us a little bit about if people wanted to work with you or know more about what you're doing.
So I've kind of, over the years, just a little bit back to my story, but over the years, I've kind of tried to jump ship many times. My daughter passed away when she was 5.5, and subsequent to that, I was like, I'm done, because it was very stressful for me to be dealing with kids with all their machinery and their equipment. And I was like, I live this. I don't want to live it anymore. We're done. And then the universe, God, whatever you believe in, the powers that be, just kept putting me right back where I started. And parents would call me, even before I was in private practice. And I was like, okay, I guess I'll just do it a little bit longer, for a little bit, for a time. And then at one point, her cardiologist had told me at one point that I should go back to medical school. So at one point I was like, I'm going to go to medical school. I'm just going to totally, like, how that made any sense. Again, let's just get back to like our, trauma responses. But there was
Yes.
no logic in it. But I did apply to a pre-med program. I started courses, and then I was like, okay, this is not practical with my life. I need better work-life balance. I was working, I had 2 little ones at home. And then fast forward, like COVID hits, and I'm like, forget, I'm done. I'm going to go back. I'm going to try one more time to go back. Maybe I should just open up a flower shop. Like, that's it. I'm going to write this book that I've been talking about. I think I have great ideas for like a shoe store. Like, there was no, I just was, okay, this is my opportunity. Like, I'm just not going to do this anymore. Yeah. And here I am. So I accept that this is where I'm really meant to be.
You're meant to be.
I'm meant to be here. I really do believe in it. I do believe in what I do. I do believe that there is hope. I do believe that we can make things better for people, for all ages. But that doesn't mean that it's not work. So that's where the magic pill comes in. When people come in here, I say, listen, it's going to take time, but at the end of it, it will be long lasting, and everybody will be in a bit better position. I was once told about my daughter, she will never be a happy eater. These kids are not happy eaters.
Do you mind sharing what her name is?
Her name was Hannah Ahuva. Hannah meaning grace, Ahuva meaning beloved, and Toba was her last name. Toba means dove. So it really suited her. That's what it translates into.
As you are sitting here just talking, and I'm just feeling like this beautiful energy of this child that like showed you so much, that like her legacy in her life is like was to show you and teach you and help all of these parents that maybe don't have your strength, or that aura that you have, that you are able to give. It's just such a, even to share her story this much is just so humbling and so loving for so many parents to see, especially for those parents that are in those dark spaces, that are just like feeling that there is no light, to see that there's so much to go forward. I thank you so much for the work that I'm assuming she's pushing you to do the work, from wherever she is.
I do. Yeah.
She's the
reason. She's the reason. She's really, and that's why I say to parents, but like it like, you look at me, you see a professional, but it doesn't feel glamorous when you're going through it. It doesn't feel like I'm being strong, or I struggled with the decision to stay in this field, and where to go from here, and how do we help on a much bigger scale, and how do we extend beyond it without necessarily switching career paths entirely. And really, just, I think that the main thing is I really believe in these kids. I really believe in the people that are coming into my office, and I'm seeing it all. I mean, I'm seeing astounding things all the time. So I did recently, on her birthday, finally, I've been talking about it for a while, opened up a foundation. So it's really in the beginning stages, the Silver Wings Project, and it's in her name. And what I would love to do, the mission is to start giving classes, and where the proceeds will go into this fund to help families access resources that they wouldn't, either financially they can't access, or they wouldn't necessarily access because they don't really understand it, but they're willing. They show a certain openness, and they're willing to try different methods and modalities and approaches, because we really need to have a collaborative mindset. We need to be able to collaborate with other professionals and kind of outsource. So even though I always say, like, even though I have a lot of tools in my toolbox, it doesn't mean that that's the smartest thing for me to do is to try to use all my tools. Maybe I need to stick with one modality and then refer out for another modality because that's going to work really well for this kid. But that means that it's time, it's energy, and it's money. And so I feel very strongly that like this is going to hopefully be a conduit and a catalyst for, because oftentimes therapists will contact me
Oh, you're going to
personally
blow.
and
I,
email, and they have a question about this, they have a question about that, and I'm very happy to answer. But I feel like also we need a space for therapists that is supportive, and that's what I love about Dr. Barry Rayfield's office is it's such a supportive space. I feel like in feeding and in certain niche kind of markets, for lack of a better word, but modalities, it winds up becoming very competitive, like very
Mhm.
highly competitive. And I think the beauty there is that like it's really a community. And I think that the more that we can be supportive to one another and share our knowledge base and share our thought processes and our approaches. I can't make anyone think like me, but I can definitely, hopefully, try to have some impact on the way that they're looking at a child. And for me, that's invaluable. So
I
hopefully
can't tell you,
soon.
yeah, you can't get people to maybe, yeah, of course we can't get people to think that way. But when I tell you, first of all, how you inspire people and whether you even knew it, just like the way you speak, the way you are talking, there's such a, obviously, thank you for sharing. It's coming from you, from a true part of you. And it's absolutely just miraculous to see how you do it. And seriously, I've been really blessed in my career. I've listened to a lot of different people talk about this human body and us as children. And well, for anyone that was there, they know I was sitting next to you and I just was like, all right, I need you on the podcast because I could feel something inside, right? And so you will get quite blown up. And when you are ready and you are launching, we have a really large community and we have a really great platform. We'd love to do a teaser course for like a little something to put out there to get people on. All my therapists that are listening, questions and things that you want, send them in to us and we'll get them over. And this way you can see the things that maybe can help, wherever your framework's going. And when that book comes out, I promise you, I will definitely be one of the first people to pick up a copy and read it. Your story, your work is just truly inspirational. And thank you for continuing. Thank you to you and your daughter for not letting you switch careers, and that you're right here because we definitely get to reap the benefits of what you've seen, what you've learned, and how your mind works. And I'm sure there's been tons and hundreds of kids and even more to come that you support. If a family wants to contact you, we're going to obviously put all of your contact information in the show notes and everything, but is it best to reach out to your office, email you, call you? What are your thoughts there?
It's probably best to email. There's a big demand and a big need, is what I always say. Like every therapist, I feel like, they want to know that they're in demand. And for me, I just find it overwhelming. Sometimes I'm like, there's such a great need, and there's so many kids and so many families that are really struggling. And I always kind of thought of myself as like I do my own little thing. I don't really, I wasn't my vision wasn't, some people really talk about like manifesting and having a vision board and all of that. It really wasn't like that for me. I have to be honest. It was more like I just want to stay in my little hole in the wall, and I don't know. Yeah, I'm just going to be a wallflower. And again, I've just learned how to embrace it and kind of go with it because I've come to realize that it's bigger than me. I'm like, I'm not that important. Like, it's nothing really to do with me, but also I have to do what I'm supposed to be doing. So it's both. So, yeah. So sometimes I get overwhelmed by the calls that are
Okay.
coming in. Probably the best way is to email, and they
Yeah.
can email either Ronit at Agassi Therapeutics or the front desk at Agassi Therapeutics. And then we do try to get back to everybody as soon as we can. And as soon as sometimes I won't respond right away because I'm trying to be thoughtful And I want to make sure that I'm answering the question and not just trying to respond quickly. And sometimes I'll say, hey, I'm going to get back to you on this, so that they know I've read it, they know I've gotten it, but that I'm not prepared or don't have time in that moment to kind of give a response. And I do want to give them the time. So those are the best ways.
Get a
And
hold of you. Absolutely.
yeah.
Well, we will definitely be keeping an eye out. And one little last segment we do here is, if you had one little piece of advice, your little bit of elevator, somebody came to you, what would it be? What would you pass that on? What's something you'd like to share with everybody? Just a little piece of nugget of advice to tell people. It can be parents. I mean, that seems who you're connecting to, the moms out there the most. One little piece of word of wisdom to give some parents or even some therapists that are just getting started.
You'd be surprised how many dads. I always say we need to start like a dad
Oh, okay.
support group.
Yeah, absolutely. I shouldn't leave those dads out.
No,
My apologies.
you'd be surprised how many moms, dads, and
My
even
daddy,
grandparents
those are my
like,
daddy issues coming through there.
yeah.
Oh,
And they're
everybody.
like holding on to stuff. And I'm like, okay. And therapists who feel very lost or they're not sure where they should go, where they're headed, where they're at now. A lot of questions regarding just, I find about themselves. And then how do I even decide what the next step is? And so I said it earlier in the podcast, but I really believe there's more than one way to get to an end goal. And we all take very different paths. And it doesn't have to be, like you don't have to follow the ABC 1, 2, 3 to get to an end goal. And at the same time, I think we need to acknowledge, which I find is something that many of us have difficulty with, acknowledge like, you're here. How'd you get here? Like,
Mm,
why are you here? Like, what are you doing? Why are you doing it? And then what else interests you? What else do you feel speaks to you? And if that's breathing, for OTs, they're like, well, I'm into regulation, but and I'm working on all the sensory stuff. And I say, okay, and do you feel like it's working? Do you believe in what you do? Or are you just working?
that's
And what do
great.
you think would make you more convinced? Like, because then that's where you need to go next, whether it's nutrition or breathing or just becoming more informed about myofunctional therapy, whatever it is. For parents, I feel, I don't like to, on the one hand, I don't like to use like these cliche kind of overused sayings. And on the other hand, sometimes they're very applicable. At the end of the day, we need to give ourselves grace, not so much grace that we're excusing everything. And, we can't let it go that far, but at the same time, recognize like, what am I seeking help? And like, why is it for R's and L's? Is it for this? Is it for that? Is it that I had a parent tell me straight, I asked them like, well, why do you want them to eat more foods? And they're like, it's just difficult to make like 6 different meals every night for like each of my kids that like something else. And I want to just like be able to sit down at the table. But he causes the most issues when I'm making dinner. And so I was like, okay, you know what? I can appreciate an honest response no matter. And that's
Yeah.
useful, but it's important for that parent to know that that's where it's coming from. So obviously she cares about her child and, there are certain principles and just like I come to it with a certain approach where certain things are given, right?
Yeah.
There's certain givens to it.
Sounds like you really do try to meet parents where they're at. You're not trying to drag people. And there's just this beautiful humility and kindness of, as I say, making these very large concepts digestible. It seems like it's like, just be
I'm not
honest.
looking to sell anything is what I
Yeah,
tell
not
them.
at all. 100%.
If you don't believe in it, whatever it is,
Not
you
ready.
came here. So what do you want to achieve? And how are we going to go about achieving it so that, but you can't dictate therapy on the one hand, because like, that's why you're here. You're coming to a professional. So exactly what you said about trust, which I find is sometimes extremely challenging for parents. And then on the other hand, I'm like, if you could do it yourself, you would have done it. Right.
Absolutely.
It sounds like if you could do it yourself, you would have done
No,
it. So
you would have done it. So you need the therapist and you need to be. So that's,
right.
I think,
So we need to get you on board as well as your kid. It's not just about your kid. This is like a process for everybody. And then, yes, we have to recognize like where you come into play, where they come into play, and how we're going to go about kind of doing this dance so that change becomes like they can move on to from one stage to the next stage and really thrive and grow and not constantly have to be in therapy and
Yeah. Yes,
constantly going through that revolving door. And they may need long-term therapy. Like enough of these kids, let's say with syndromes, they're going to need long-term therapy, but maybe they don't even need it here. Maybe we need to get them to a place where then they can do more traditional forms of therapy. There's value, and this I tell therapists and parents, because they'll say, well, this therapist, I know you probably won't agree with her. And I say, there's value in all these modalities wouldn't exist. We wouldn't be practicing WH questions. Practice makes perfect. Like the old adage holds true, except when there are underlying things that are getting in the way. But at some point, yes, strengthening that muscle of telling a narrative is worthwhile. So I believe that there is all the different therapies they're all valuable on some level. We have to think about timing. We have to be timing and appropriateness of where the parents are, where the child is at, so that we can maximize outcomes. I mean, that's the goal, right? I can tell you your kid needs a tongue tie revision and myofunctional therapy, but if that kid, totally decompensates and loses it, then we've accomplished actually nothing. So
really about meeting people where they're at and
yeah,
absolutely getting them to do it. Well,
yeah.
I think on that note, that is a perfect place to remind people that we are here to support you. And again, we will meet you where you're at. So I'm going to make sure in the show notes for everyone to be able to find you and connect you. We look forward to all of your future work. We're so excited to see what you're up to. Thank you so much for giving time today on the podcast. We appreciate it so much. For all of you guys, thank you so much for tuning in. And I look forward to seeing you guys all on the next episode of Mind Your Mouth.